Hi, we're here with Layla, Dr. Dave talking to Layla. Layla's agreed to do a video. This is our video. We haven't done a video in quite a while, probably like 6 or 7 months, because of the wonderful mask wearing thing and pandemic that's going on. So we're trying to start redoing some videos, and Layla was nice enough to don the mask and talk about her spine, which you'll probably see behind me, which she is a little surprised about seeing.
Yeah.
So Layla's 18, she's a dancer. She's been dancing since you were 2?
2.
2 years old, and for a lot of your life you were dancing for 20...
Yeah, like 20 hours a week.
20 hours a week. And she also did cheerleading.
Yeah.
And in that, she had people fall on her, land on her, hit her in the head. At times she said, I believe you said that you had shots to the head and at times bloody noses.
Yeah, yeah, that's true.
All right,
definitely true.
So that stuff can create problems in the spine. And so Layla came in with lower back pain. And as we went through her consultation, asking her about other things, she was just like, I have some low back pain and some soreness.
Yeah.
And as we were talking, asked her about her neck, her shoulders, headaches. And it just turns out that she has other things going on. And she gets headaches at least 3 times a week. And she takes some over-the-counter meds to try and help them. And one of my goals with her is to get her headache free.
That would be amazing.
So we don't have to do that anymore.
Yes.
So we did some scans on Layla, and if you're familiar with these, you've seen us do these scans before, and these scans are kind of like a snapshot into what's going on with someone's body, all right? Their nerve system and their muscle system. So this one is looking at her nerve system, and so the nervous system controls everything. It's our brain and spinal cord, and as I told Layla, it's the way our brain communicates to the body is through the spinal cord. So you got this tube of bones called the spinal column that surrounds and protects the spinal cord. The brain is protected by the skull. But this tube of bones could be out of alignment or stress due to life. So we're talking about her cheerleading and dancing, creating misalignments, tension, and stress on the spine. And these are showing areas in the nervous system that are affected. They're irritated. The colors indicate how much. So green is mild, blue is moderate, and red is severe. So you see areas in her upper neck region and all throughout her mid-back region. These go to different organ systems. All right, so one of the things we're talking about is I'm finding an upper neck problem in her. And if you look at some of this is like school today for you people. Upper neck can create things when you have a problem like headaches or migraines or difficulty sleeping or digestive issues. And actually, we were just talking about that because she has some digestive stuff showing up on her x-ray. Anything to do with your anxiety, depression, etc. All right, sinus problems, allergies. So that's just the upper neck. Every one of these things goes to a different region of the spine and controls something. So we want to get these colors out of here and get more towards white. This is stress in her muscles, tension in her muscles. This is a normal muscle scan. It's pear-shaped, it's white in color, it's symmetrical, and this is her. The areas of colors are all areas of stress and tension in her muscles. Again, green is mild muscle tension, blue is moderate, red is severe. This is muscle imbalance, how her muscles are pulling on her spine. Her right side's pulling harder in her lower back, then it shifts to the left, then back to the right, then back to the left. It's like tug of war on her spine, creating different tensions and stress along the spine. So her body is under a lot of stress and tension. This is like, as I relate to going to the medical doctor and getting blood work in a sense. It's showing you, here's what's going on with your body, here's what's in range, here's what's out of range, and our goal is to get this stuff back in range. So it's a physiological, neurological, muscular scan to look at what is going on with her, and we'll do these throughout her care to see her progress. It creates a score called a core score. It puts an average of all these things, and her score is 76 out of 100, we say. She's working at 76% of her 100% potential, and we want to get her up higher. She's called what's in a transition phase. When a person's in a transition phase, they're either going to transition into worse or better, and we're going to intervene and get her better, right?
Yes.
Right. What I like about Layla, number one, you have great energy.
Thank you.
I haven't seen her smile yet, but it looks like you smile a lot.
do.
She's very personable. I mean, I deal with a lot of 18-year-olds and dancers and stuff, and you're very personable,
Thank you.
easy to talk to, great energy, and I already appreciate you and already know you're going to do great with care.
Thank you.
So behind us is her x-ray, and I'm not going to turn you all into radiologists, but we're looking at her from behind. And as you can see, she's not straight, right? She's got a pretty big scoliosis. I didn't write the numbers in here yet as far as degrees. I haven't calculated that yet, but we're looking at her from behind. This is her left side. This is her right side. Pelvis, hip, left hip, right hip. Her pelvis is tilted this way. Think of this in 3D, all right? The pelvis tilts, it rotates, and then it torques in this direction. So she's tilted, she's rotated this way, and then she's torqued this way. Some of her problems are lower back pain and hip soreness, especially after dancing. So she has this spine this way, and then she's dancing, and it's no wonder that she's having lower back pain and soreness down here. And by the way, she's been having pain for 5 or 6 years.
Yeah.
And by the way, so we were talking,
Yes.
and in the consultation, when we were talking about headaches,
Yep.
I'm smiling at you right now, but you can't
Yeah.
see it because
No, I
it's
can
like,
tell. I can tell.
because I think, and I talked about you on the radio this past week a little
Yeah.
bit, because we talked about in the consultation with headaches. I said, do you remember what you said to me about when I said 3 times a week about headaches or
Yeah.
about body pain? What did you say?
Me? I
Yeah.
thought it was normal. I
Normal.
thought it was common.
She's like, I thought that was normal.
Yeah.
There's nothing normal about headaches, number one. People have them, but she also said they were common.
Yeah.
So don't confuse common with normal. There's nothing normal about headaches.
Yeah.
They're common, and usually they're a result of a few different things that could be related to spine, hormones, food, or just trauma. And unfortunately, some people have had trauma and have had headaches as a result of that and ongoing. But a lot of times they can be helped with either chiropractic or dietary changes, etc. But I don't want you to think pain is normal.
Yeah. I thought it was normal.
She's learning.
I'm getting there.
You're getting there. So her pelvis is tilted and uneven. She has a scoliosis. It's curvature of the spine. It's not only curving this way, but these things are very rotated. These little blade-like things should be in the center of the vertebra of the spine. And these are just way over here. So she's got this torquing of the spine all the way up as it rotates and curves at the same time. And that's creating the tension and stress on the nerve system, the nerves, the spinal cord, and creating the muscle imbalances and the ligament sprains throughout the whole spine. From a side view, right, the curve, there should be a curve in the neck going this way. Layla has no curve, and it's actually reversing and going in the opposite direction.
Oh, goodness.
There should be a curve in the spine here in the mid-back. There's no curve. It's flat. It's just a flat curve, but there should be a curve in here. In the lower back, there should be a curve, which she has, but it's exaggerated. This is increased from normal curve. And then this part starts to reverse and go the other way. She also has signs of arthritic spurring already at 18 from trauma. She's got different areas of stress already to the spine, already the beginning signs of arthritic changes. So that goes to show you that arthritis is not an age thing per se. It is either a result of trauma or long-standing misalignments. There could be nutritional factors too that could affect it as far as not hydrating yourself and not nourishing yourself properly. But here are some of these curves, right? It should arc to the front. She doesn't have an arc. When you have misalignments, you lose the curve. Then you start getting these points form. These are arthritic spurring over time. Curvature in your mid-back should be going this way. Again, it's straight. And then down here, it should curve, but you have a curve, but it's a little exaggerated here, and it starts to go the opposite direction here. The purpose of the curves is to act as shock absorbers, all right? They absorb stress throughout your day. When you don't have the curves, it's like a shock, it's like a stress transmitter. It just shoots stress throughout the spine, and you just start to feel it more. So that's some of her functional assessment. When we were sitting in the chair, when she first came in, she was sitting down. Her right shoulder blade was higher than her left, like almost 2 inches.
Yeah.
Her boyfriend was with her the first time, and I had him look just to make sure I wasn't lying to her.
Yeah.
Because I tell people these things, and they're like, yeah, okay, whatever. But her shoulders were uneven. Her right shoulder's higher than her left. It's drawing up the shoulder blade on that area. And
Yeah.
then her pelvis is torqued. You can actually see
Yep.
it. And then her right hip is higher than her left.
Yep. Yep.
So, structure affects function, all right? When you're structurally off, it affects the function of the human body in the form of symptoms. So, that's Layla's overall presentation as far as her scan and her x-rays. So, we're going to adjust her for the first time. She's never been adjusted before.
Nope.
This is exciting.
I'm super
This
excited.
is,
I'm super excited.
She was pretty shocked to see her film.
Yeah, definitely. Definitely a little shocked. I knew there was going to be a curve, but I wasn't expecting to be as dramatic as I think it is, personally.
Yeah, that's pretty big.
Yeah.
Yeah. I didn't do the degrees of scoliosis yet. I have to calculate those, but that's a pretty significant scoliosis, I would say. Yeah. So what we're gonna have you do actually is take your shoes off too, because I'm gonna check your feet. That you're a dancer.
Okay.
And when you come in from room 1, 2, or 3,
Yeah.
when you come in from one of these rooms, you'd sit in this chair and face that way. Right? So I'm gonna have you sit here and face that way.
Okay.
Actually, I'm gonna have you take your necklace off too. Is that
Okay.
right? And your hoop
Yeah.
earrings.
Okay. Got it.
And as she's walking, I could see, like, as far as her feet, like, she pronates. Her arches in her feet drop.
I'm just gonna put these here.
So
I'll
that's
grab
going
them.
to affect her.
I'm trying to fix it now.
Now she's correcting it.
No, I'm not. I'll just walk.
No, I think so.
There
So
you
you
go.
see, like, her arches drop,
They
which are
drop.
going to affect her feet, her knees, her hips, and that could be contributing to scoliosis. So I'm going to have you sit here and face this way. When she comes in, I'm going to scope her with this instrument each time. This is a heat reading instrument. It just helps guide me where I'm going to be adjusting each visit. In addition to what she tells me as far as hurting or whatnot symptoms, but I don't only go off symptoms. I go off what her symptoms are and what I find objectively. So right here, as far as this instrument, I find a little reading here. And I mark that just to go back to it and feel it later. I'm going to come up under your shirt and just scan this way, okay?
Yep.
And then she takes off here to the right. Now there's some people out there that are gonna complain about me not gowning her and having this shirt and bra strap in the way, but they'll get over it. You know, when you put your video out there, it's out in the world, and
Some people criticize.
there's just the world of haters. So when I did her pelvis, when I checked her pelvis last time, I already know she's got pelvic rotation. I checked it last. She has a double pelvis. Both sides are locked up, okay, and they're not moving right. I mean, here's her shoulder blade height. So I'm gonna bring my arm around you, okay?
Okay.
Just gonna feel how the bottom of your spine is moving. Sorry, my hand's cold.
You're good.
And I definitely feel a locked up left side here, more so than the right. And then in here. T5. And T12. Probably going to leave T12 alone for like right off the bat, because that's kind of where the apex of the scoliosis is. A lot of times you don't want to adjust the apex of the scoliosis. You got just a ton of muscle tension all on this left side. And in your traps. What is all this tension?
I don't know, but I can feel it when you do that.
All right, come on over here. So this table, you're going to step up on this platform, your face goes on here, and your hands go on these things, okay?
My face goes here, and I grab these.
You got it. And the table's gonna slowly go down.
Okay. Don't get the hole in my sock on the video.
Well, now we all know it's there.
I know.
We shouldn't have said anything. We probably wouldn't have noticed. All right, so you're gonna relax your shoulders down, okay? If you have to drop your arms or hands to the sides, that's fine. Now, she has a flat mid-back spine. That makes this harder to adjust because it's hard to get into the spine and through it. Sometimes I have to put the person on a knee chest table over there, but being this is her first adjustment, I'm not going to go crazy on her spine, right? I'm just feeling muscle tensions right now. I'm just feeling a tension in her traps. I feel all these muscles pulling here. I feel them pulling here. Just getting a sense of just what her body's feeling like. You can look at legs. You know, her right leg is a little shorter than her left. If you want to look at leg length, that has to do with tilting of her pelvis. Right? She's got a high right hip, so it draws the leg up on that side. You could bring her legs up and just get a sense of, and now her leg gets even or a little longer. So it's a sign of a functional problem on this side, not anatomical. Check her knees out because I'm going to probably adjust her knees since she's this knee is, yeah, you're totally, huh?
Now that we've established she's a mess.
Yeah.
Be glad you
Come
caught
on
it early.
this side. All right, so I'm going to adjust here first. And so your job is to just drop these shoulders down, Layla, right? What you're going to feel me do, you're going to feel me lean into you and push, okay? And you're going to feel popping noises like that. It's already kind of popping. So you're going to feel me lean and push. Good job. The noise is gas releases, all right? It is not bones breaking or cracking. Just so you know.
Got it.
So I'm going to leave that guy alone for right now. All right, I'm going to take this speeder board. I have a little board in my hand. I'm going to put it under your knee. And you're going to feel me just pushing. It's going to drop, okay? So this is adjusting your knee. Many different ways of adjusting a knee. You okay?
Yep.
If I do anything that hurts or feels weird, just let me know. Doesn't mean I'll stop, but at least I know. Like, I don't know if you feel that gliding different already, but I do.
Yeah.
Just adjusting her fibula heads here. Because she pronates with her feet, it affects the angle and rotation of the knee, and it throws her knee off. You're gonna bring her up, okay? I know down there with a mask is no fun. And have you turn around on your back on this table, okay?
Okay.
And then we're gonna go backwards.
Oh, okay.
You don't have to hold on so tight.
I'm just
You're like
making
white-
sure I don't fall.
White knuckling the table. No. So I'm gonna work on her feet here. So you're gonna feel me just work on these piggies of yours that have been abused for 16 years, right?
Yeah.
Her
This
towel.
all happens to be my favorite part of the adjustment.
Yeah, this is great.
Just so you know.
Oh, you mean this hole?
Yeah, that hole. Whoa, 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 whoa.
Right there. And it's alright, you already signed the permission slip. It's too late now.
She'll never wear holy socks here again.
No, I will not. Absolutely not.
Work on her naviculars, her talus, her cuboids. They're all feel all locked up. Calcaneus. Move up to her knees. Doing good so far?
Yep.
So I'm just gonna take her knee here. You're gonna relax your whole leg. There we go. And I'm gonna pull. You're gonna feel it pull all the way up.
Oh,
okay?
great.
It's all right.
Okay.
Same thing. Good job. All the way up.
Let me scooch back up.
Take your. You're gonna grab my wrists, Layla.
Here?
Yep. I'm just gonna stretch you out like a rubber band. Just elongate you.
I like slid all the way up the whole table.
And I'm gonna bring you up here.
Alright.
We're going to this table next. She's gonna wear different socks and different clothes here next time.
Yeah.
Alright. So you're gonna lay on your side facing me.
Lay on
Okay.
my side facing you.
Your shoulder goes here
Here?
and your head goes here.
Okay.
And I'm gonna be over you somehow.
Oh, okay.
Trying to watch.
We're gonna straighten this bottom leg, keep the top one bent. You're gonna bring your arms here. I'm gonna pull you closer to me, but I'm not gonna drop you on the floor, okay?
Mm-hmm.
This first one, I'm going to pull this way, and the second one, I'm gonna push this way, okay?
Mhm.
So I'm gonna do a pull move first on her pelvis. And then I'm gonna adjust her sacrum on this side. Good job.
What do I do now?
You're gonna push yourself up with this elbow, actually, and sit
Uh-huh.
up and face me.
That way?
We're gonna go back to that chair.
Back to that one?
Uh-huh.
Okay. My hair's falling out now.
That's how you know it's a good adjustment.
Yeah.
Now I'm just gonna adjust her shoulders or stretch her shoulders back. I'm gonna bring my arm around you. You're gonna feel me just pull back. She did tell me she was like the best dancer ever, though.
That's not true. Not the best dancer ever. Say I'm pretty good.
Look, you said you do hip hop and jazz?
I do every style you can kind of think of. My main two right now are hip hop and contemporary, but I've done everything for the most part.
Is that what you want to do? Be a professional dancer?
Well, I mean, if I had the opportunity to do it, I would absolutely take up on it. But it's a really hard world to get into.
Just adjusting your wrists, fingers, elbows.
She's gonna walk out here a whole new woman.
Feels good.
She's handling this really well. Like, this is her first time ever. Like, so many people tighten
was
up or freak
excited.
out or yell or scream. She's just like
I'm super
going
excited.
with
She couldn't wait.
it. Just feeling your spine, your pelvis again. Just getting an idea of. Need to check my work. Make sure what I did what I wanted it to do. lot of left side of tension here. Up there too.
Mm-hmm.
Okay, so I'm gonna put this strap around you.
Mm-hmm.
This is a seat belt for safe adjusting. Now this just helps keep you in the chair, so when I adjust this, I'm pushing forward, you don't go forward.
Okay.
So next are adjusted sitting, and what I'm going to do is bring your head to the right, okay?
Mm-hmm.
And then you're gonna feel me just lift up, and I'm gonna push forward that way. You're gonna hear a cracking noise. It's close to your ear, all right?
Okay.
Your job is to just relax. Drop this right shoulder down. You all right down there?
Yeah.
Okay. That was loud.
Yeah.
Beautiful. Well done.
Thanks.
I mean it.
Now, of course, I feel more, but you don't want to just overwhelm the person and the body because I just did something, and you don't want to over adjust because you don't want to do a whole bunch of stuff, and then you don't know how the body responded well to, didn't respond well to something else. So I adjusted her C2 on the right, I adjusted her T5, and then her left ilium this side, or left sacroiliac joint. So she did really good. And I adjusted her extremities. She relaxed throughout the whole thing, probably partly because she didn't know it was coming.
Yeah.
But I already feel these not as tense.
Mm-hmm. No, definitely.
Have you get up and just walk like to there and back, just reset your body a little bit.
To here?
Yeah, just see if there's anything different.
No, I feel good.
Feel... So you're gonna feel one of three ways.
Yeah.
All right. You're gonna feel the same, like
Uh-huh.
nothing's changed yet.
Yeah.
You can feel better.
Yeah.
You got more mobility, less tension.
Yeah.
Something's different. Some people say I feel different. I can't explain it, but you're
Yeah.
gonna feel better.
Yeah.
Or you can feel really sore.
Okay.
So if you feel any one of these, don't get concerned or worried,
Okay.
especially if you feel more sore. It's just we're starting to retrain things,
Mhm.
and you can feel more sore.
Yeah.
Use ice.
Mm-hmm.
If anything, no heat, no
Yeah.
like heating pad,
Yeah.
and drink lots of water. Hydrate
Okay.
yourself. We're here till like 8 o'clock tonight, so if you have questions or
Yep.
anything, just call here and But I'll probably check up on you
Sounds
either
good.
tonight or tomorrow and follow up and see how
Yep.
you're doing. Any other questions for
No.
me right now?
I feel great.
You feel great.
Yep.
Thanks for being an awesome sport and doing this.
Absolutely.
And maybe what we'll do is in a bunch of visits do a revisit
Yeah.
scan to see how you're doing, and
Mhm.
you can tell people how you're doing along
Yeah.
the way.
Sounds good. Yep.
All right.
Good.
Well, thank you for checking in, and we will do this again. And thank
Yep.
you. Have a great day.